Hello, this is Suzanne with Donovan's Hypnosis. I have a question for you mental health therapists out there. Are you getting bored of listening to your patients' stories? Are you finding yourself drifting off during your sessions? Are you finding that you're not interested any longer? This is a problem that a lot of folks have after they've been delivering therapy for a lot of years. And it's really worth recognizing that reality. Maybe you're feeling that you're hearing the same stuff over and over again and it's just no longer interesting. Maybe you're just not interested in dealing with these patients any longer. Maybe you're just sick of doing therapy. Maybe you're depressed. And it has nothing to do with your work situation. It has to do with something that's going on with you. And therefore, you don't have the attention to give to your work any longer. Whatever the reason, it's important for you to take a look inside to figure out what is causing the boredom. And hopefully you have a supervisor who you can go to and talk to about this. It is what they're supposed to be there to do, help you through your troubling times, either with yourself or with your patients. But not all supervisors are capable of doing this. Sometimes only supervisor in name only. And I've certainly had my share of supervisors who truly sucked. Sad, but true. I would suggest that you journal about it on a daily basis until you understand what's truly going on with you. Because if you do automatic writing, don't worry about spelling or grammar, nobody cares. You'll figure out why it is that you're feeling bored and what you need to do as a result of that boredom to get yourself out of it. What the issues are that you need to address to move forward. Because the reality of the situation is that, well, it's okay to choose to do something different for your career. A lot of people do it. I think the average number of careers that people have these days because of our long lives is like 5. 5 different careers, not jobs, careers. So journal about what you'd like to do instead of providing therapy. And it may still be in psychology or it may be in something totally different. Maybe you have a hobby or something that you really dreamed to do that you never allowed yourself to do because it wasn't, practical. I was never one who believed in practical anything. Anyway, not really. Kabbalist, Jewish mystics, would always speak about being illogical. And what they meant about being illogical was to do those things that were not logical so that you could actually bring some magic into your life. They didn't use the word magic, but I will. Because when we're able to do the things that we truly love to do and create magical moments for ourselves, as I do with all my travels all over the world, with all the amazing people that I am able to interact with and get to know, especially when I spend longer periods in certain places, it is indeed magical. And if that's not enough for you, I do offer a breakthrough session to help people to get themselves unblocked, to allow them to figure out what their compelling future is so that they can actually live into it. Because, the problem is only 20% of the situation. 80% is what do you want to do next and how are you going to go about making that your reality? So if you're interested in learning more about my breakthrough session, which I use hypnosis and linguistic programming to help you to figure out for yourself, by all means, check out my contact information in the description box below and contact me and we'll set up a video call so you can learn more about it. That's all I have for you folks. As always, I thank you for spending your time with me. Until next time. Bye-bye all.